Orange County Board of Supervisors hereby declare September as Suicide Prevention is actually a week in Orange County. Suicide is a global concern and a serious public issue, and is the 12th leading cause of death in the United States. During National Suicide Prevention Week and every day, we remember those we have lost to suicide. It's a time where communities are bound around the county and country join voices to amplify the message that suicide is preventable. Knowing the signs of suicide, finding the words to talk with someone that may be thinking of suicide, and reaching out to local resources are actions everyone can take to care for themselves and others. I'd like to invite my colleagues who would like to say a few words, and then invite Dr. Kelly and Dr. Rao, the Orange County Health Agency, to accept the resolution. Mr. Vice Chair.
Thank you. Many of you have been given these candles. They are a symbol, not just of hope, but sometimes when they get blown out, how easily that hope can be lost. Every one of us can be a candle to give hope to folks that are suffering. We know over the course of the last few years that suffering has increased. We're seeing more calls to our helplines. We are seeing a rise in suicide. It's out there. It can strike any family. And it's on all of us to be vigilant and offer the kinds of help that we can offer, being a friend, talking, and steering folks towards the appropriate professional resources. Thank you to the county staff, Dr. Kelly, and all of the folks that are working for her and working so hard to stem this tide and keep these lights burning.
Thank you. Good morning. What a glorious facility, and appropriate to recognize the solemnity in which we recognize National Suicide Prevention Week. It's something that has also hit my family. So it's an issue that is very near and dear to my heart. Every day there are people who suffer in silence, and for many it's too difficult to talk about, much less to get help. So it's up to us to reach out, to let people know that we are here for them, and that there are resources that they can access. And for that, I want to thank the Office of Suicide Prevention, all the great work they do in publicizing this issue and letting people know that there is help and that there are people out there that can help people in times of need. And I want to thank Dr. Kelly and the office for the great work that they do. Thank you.
Good morning. Like Supervisor Doe, my family has had the unfortunate situation to have a family member who suffers from suicide ideation. And this is why it's so important this month and every month that we make sure that members of our community, especially our veterans who are isolated and who maybe struggle with issues that they suffer from due to combat fatigue, and also our LGBTQ community. We have so many youth in our community right now who are struggling with identity and who are isolated. And we have amazing resources thanks to our amazing staff here at the county. And we just want to make sure that we amplify the good work that they're doing, and we make sure all of you know about the resources available so that we can save lives in Orange County. So thank you for holding up your candle and lighting the hope for this month, and hopefully that will continue every month. Thank you so much.
So first of all, welcome to our new chambers. We are so delighted to be in a new building and to have all of you here with us this morning. When you talk about suicide and mental illness, when you just hear my colleagues, and just about every one of them said that suicide and mental illness has touched people they know, their family members, and people in their friendship circle. So it's something that's very prevalent in our county, and it's something where we need to be really proactive. Losing even one life to suicide is unacceptable and absolutely devastating, especially when we know it can be preventable, but we have to be proactive. In Orange County, seniors and older adults, and especially males in particular, have an elevated risk for suicide. And our local data shows that geographically, the cities with higher suicide rates in my district and in the coastal areas are Seal Beach, Laguna Beach, Huntington Beach, San Clemente, and Newport Beach. And when you think of those areas, you don't think of them as being a higher risk for suicide, but they are. Research indicates that the 5 Ds, disease, disconnectedness, depression, disabilities, and deadly means, are contributing factors towards an elevated risk for suicide, especially for the seniors. We need to continue to address the stigma that often comes with a barrier to seeking timely care. We need to encourage our seniors and older adults to connect with programs that increase their participation in the community and provide meaning and purpose to their lives to combat those 5 Ds. We have a lot of resources here at the county, and we're getting more things and more initiatives and things online and working with our local nonprofits to a greater extent every single day. I really appreciate the board continuing to work in Orange County relative to suicide prevention. Many of our programs and supportive services can help build resiliency so individuals of all ages throughout their lifespan can live healthy lives. So each one of us can play a role by learning the warning signs of suicide and reaching out to someone that we might be concerned about, because together we can truly make a difference. And when you think about it, it could be saving someone's life. So look for the warning signs and don't hesitate to contact us at the county, contact our healthcare departments and our professionals that we have here, or any of our nonprofits. We're there for you as a resource. So don't hesitate to reach out. Thank you.
Thank you so much. I'm Dr. Veronica Kelly, the Chief of Mental Health and Recovery Services for the county, and I want to first start by thanking our Board of Supervisors for their amazing support and leadership. I've been in county government for 25 years, and this county shines when it comes to our board really supporting the health and welfare of her citizens. So let me start with that. National Suicide Prevention Month and Week is a time for all of us to acknowledge the fact that suicide is preventable. And so if you're worried about a friend or a family member who you think might be contemplating suicide, these are 5 action steps you can take to stop that. The first one, ask the question, and that means be direct. Don't pussyfoot around and say, "You're not thinking of doing something stupid, are you?" That's not helpful. What is helpful is to ask directly the question, "Are you thinking about killing yourself?" And then zip your lip and listen without judgment. What we know is research shows us that talking about suicide, especially for someone who's contemplating suicide, reduces their anxiety and reduces the risk of completing a suicide. Second thing, be there. Whether that's in person or virtually, on the phone, be there. And call for backup if you need it. If someone just tells you they want to complete a suicide, they want to commit a suicide, don't leave them alone. What we know is increasing connectedness and decreasing isolation are protective factors that protect us against suicide. Third thing, keep them safe. Find out if they've already done something. Have they done this in the past? Maybe they took some drugs or some medication before they shared that information with you. Do they have a plan? That just tells you how imminent the risk is, how imminent the danger is. And then in particular, as the supervisor mentioned, find out if they have access to firearms. Having a gun in the home exponentially increases risk of suicide by 8 times for men and 35 times for women. Fourth thing, help connect them. It's not okay just to walk away, think that they're okay if they tell you they are. Stick around and help them connect to resources. You can help them call 988, which is the 3-digit suicide prevention hotline number. It goes directly to Dee Dee Hirsch, who's one of our providers here in this county. You can also go on the internet to ocnavigator.org and find any resource that you need, or you can call 1-855-OC-LINKS to get connected immediately to resources. And then finally, follow up. Research shows that just the act of sending a quick email to make sure someone's okay decreases the risk of suicide. Really important that we all remember that we can take action to prevent suicide. Suicide is preventable. And now I'd like to ask Dr. Rao to come up and share some words.
Good morning, everyone, and thank you, Dr. Kelly and the Board of Supervisors for really bringing this issue to the front lines. To observe National Suicide Prevention Awareness Month in September, we are really excited to share that the Orange County Healthcare Agency is hosting a week-long campaign called Light Up Hope OC to raise awareness of this topic, as you heard from the speakers before. Starting September 19th, we are going to be spotlighting some iconic buildings throughout the county. And I'll just name a few. There's a lot more in our list, starting with the Huntington Beach Pier, Knott's Berry Farm, Arctic Center, Nixon Library, John Wayne Airport, to name a few. These lights will be teal and purple to highlight the message that you just heard, that suicide is preventable and that there is help available. The colors, teal and purple, symbolize suicide prevention awareness, and it serves as a reminder that suicide is an issue we really need to talk about openly, as you heard before as well. One life lost to suicide is one too many. At this time, I would like for us to observe a moment of silence to honor those whom we have lost to suicide and pledge to do our part in suicide prevention. Let us pledge that we will inspire hope, especially to those who may be struggling. Let us provide them reasons for living by being there for them, by having open conversations, and let them know that we care about them, and more important, that there is help available. So please, if you would join me in holding a candle that was provided to you for a moment, and let us shine a light on hope. Thank you very much, and thank you very much to the Board of Supervisors for really supporting our efforts in Orange County.